All right. Hello. Hello, everyone. We're just about to get started with today's Instagram Live. Today we're talking about vaginal health or front hole health to help you kind of figure out what might be going wrong or right down there, and also to be on the lookout for anything that might be going on with a partner or someone that you were intimate with. These tools and tips will kind of help you support both your health needs or your partner's health needs and kind of just be a tips and tricks toolbook for when things might be signaling that it's time to go to the doctor. And I have a colleague joining. Awesome. And we are just about live. Well, or Instagram's struggling today. Won't let my colleague join. Hopefully they're able to shortly. How's everyone doing? What did you do on this beautiful day with gorgeous weather in the DMV? Feel free to post it in the chat. Hey Paul, how are you?
Good, how are you?
I'm good.
Flip this.
Awesome. Thanks for joining. Cool. Welcome everyone. My name is Jewel and I use she, her, hers pronouns. During the COVID-19 pandemic, Whitman-Walker Health's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about sexual health, practices and access to care, as well as social determinants of health, public health interventions, and just everything public health. The community health team is here to support you. Yeah, so again, my name is Jewel and I use she, her, hers pronouns. Today we're going to be discussing vaginal health, front hole health, and just kind of talking about signs that the vagina might be telling you of when it's time to go to the doctor. Paul, I don't know if you see there's like a little camera button and mute button that might help turn off some of the sound.
Oh, okay, sorry.
Thank you. Cool. Yeah, so we're going to talk about vaginal health today and just signs that the vagina might be signaling that it's time to go to the doctor and kind of what the keys or signs of a healthy vagina are or healthy front hole are. These tools can be really beneficial to help you or your sex partners kind of keep healthy and just know when it's time for a doctor's visit. So whether you're a person who has a vagina or identifies as someone who was assigned female at birth, or you are intimate with people who identify as either of those individuals, this can be a super beneficial lie for you. So to start, some basic anatomy and vagina facts. The vagina or vaginal canal solely refers to the vaginal hole where babies can be delivered from, and it's usually where insertive sex happens. The rest of the area is known as the vulva, which includes the inner and outer labia or vaginal lips, also known as the labia minora and labia majora. This area also includes the clitoris, clitoral hood, and mons pubis, and this is kind of where the pubic hair or pubes come from. And then finally, the urethra, which is where urine or pee comes from. So a few facts about the vagina or the front hole. The clitoris is a much more sensitive muscle than the penis. It actually holds about 8,000 nerve endings, which is twice as many as the penis does. So it's a super sensitive area, and it's kind of the key to pleasuring a person who has a clitoris, despite large social emphasis on insertive and penetrative sex. Another fact is that the vagina is self-lubricating. So with that in mind, lube still goes a really long way for a more pleasurable experience for all sex partners involved and can help prevent rips, tears, and cuts during sex. This is super important because rips, tears, cuts, and what have you is what makes it easier to get an STI during sex, but especially during unprotected or condomless sex. So explore your water-based and silicone-based lube options. And another fun fun fact is that silicone-based lube is actually, it will stay wetter for longer than water-based lube. Another fact is that the vagina is self-cleaning. So as it cleans itself, it produces a white or clear discharge. During menstruation or when you're on your period, hormonal changes can affect the amount of discharge that is produced, but it is the self-cleaning part of your body. Super cool, I know. Another fact is that it's really important that you urinate or pee after sex or intercourse. Peeing after sex will help minimize your chance of getting a UTI, which is also known as a urinary tract infection. This is when bacteria gets into your urethra and may cause painful or frequent urination. So by peeing after sex, you kind of help filter out any bacteria that might have creeped up into and around the urethra during sex. So I would say if you're looking to leave this Instagram live today with any important facts moving forward, this is one of them. Definitely always pee after sex. Um, you know, if you don't, you can learn the hard way, like many of us have in the past, and many of us will continue to learn in the future. But frequent, painful, and uncomfortable peeing sounds just like as it's described. Another fact is that Kegel exercises can help strengthen the pelvic floors and build and restore vaginal tonus. So this is super helpful for any person who has given birth through the vaginal canal and is looking to restore elasticity or tightness to their vagina. And on that note, please note that most vaginas or front holes are going to return to their almost pre-birth size of like tightness and tonus, despite what the folklore and myths might have us thinking of kind of the life of a vagina after giving birth. And one more fact, if you notice any symptoms like pain during sex, itching, a foul-smelling discharge, green or yellow discharge, a fishy smell, or burning down there, then it's probably a sign that you should see a doctor and get tested for bacterial infections and STIs. These are signs to look out for in your own body or in a sex partner's body. And it can be a really easy thing to miss this change going on with your body. And for you to continue to be sexually active while missing said change. But it's just really important to be proactive and paying attention to what's going on with your body, and also paying attention to what's going on with your intimate partner's bodies. Now, this really cool article on Healthline kind of broke down vaginas and front holes by decades, or like kind of by their lifespan. So here are some cool tips and information about kind of your vagina in each different decade of your life, starting in your 20s. So according to Healthline, your 20s are some of the most golden years for your vagina. This mostly is due to the peak of sex hormones in your body, like estrogen, progesterone, and testosterone. Specifically, estrogen's main job is keeping your vagina lubricated, elastic, and acidic. Maintenance should be pretty minimal, other than having to do daily washing with mild soap and water. Now, when you get to your 30s, according to Healthline, your inner labia may darken due to hormone changes, and if you become pregnant, vaginal discharge may increase and appear milky. After giving birth, no matter what age you're at, your vagina may lose some of its elasticity and be more stretched than usual. So those Kegel exercises that we talked about earlier are going to be really key and come in handy here to gain back that elasticity and that tightness. In your 40s, you'll start to experience perimenopause. So if you're around your mom and they were getting hot flashes and whatnot, this is kind of that time period. This is the time just before you stop getting your period or stop menstruating. The estrogen levels in your body decrease and your vaginal walls become thinner and drier. This is known as vaginal atrophy. During this time, you may experience more vaginal burning, vaginal redness, painful sex, vaginal discharge, vaginal itching, burning during urination, shortening of the vaginal canal, and you'll be at an increased risk for sexually transmitted infections. Again, because we talked about those, tears and rips and cuts in the vaginal walls being easier ways to transmit STIs. I know that was a long list, but there are some silver linings. If you have a regular sex life, or just having regular sex in general, will help slow the progress of vaginal atrophy. How, you might ask? It's that it helps increase blood flow to the vagina and helps keep it elastic. Sex is an activity that doesn't lose its magic with age. So, stay active. For the dryness, though, this is a great time to explore more of those lube options that we discussed earlier, like water and silicone-based lube. Over-the-counter vaginal moisturizers and estrogen tablets and rings and creams are also an option. Now, vaginas in their 50s. By now, you probably aren't getting your period anymore or menstruating. Your estrogen levels are at a very low or depleted level. Your vulva may also appear like it has shrunk, but this is common for vaginas who are living through their 5th decade of life on this earth, so totally normal. And according to Healthline, low estrogen may change the acidity in your vagina. This may increase your risk of infection due to bacteria overgrowth. On the other hand, low estrogen doesn't only impact your vagina, it also impacts your urinary tract. So atrophy may occur in your urethra and lead to urine leakage or peeing on yourself a little bit, an overactive bladder, and frequent urination. Oral or vaginal hormone therapy can help fight this, but here are a few other remedies to support this. You can do bladder training exercises. You can use a vaginal dilator to improve vaginal elasticity. You can eat a healthier diet. You can maintain a healthier weight. You can reduce or eliminate caffeine from your diet. Good luck to anyone who loves coffee or caffeinated tea. You can stop smoking. You can do Kegel exercises and other pelvic floor exercises. You can also use vaginal lubricants or vaginal moisturizers. I think all in all, it's important to know that all vaginas are going to age. Some folks grow to love their vaginas or front holes more as they age, and more than ever as they age. But you can't prevent every aging vagina. Sorry, you can't prevent every effect that aging has on your vagina or frontal. But here are some tips on how to take good care of it. You can get regular gynecological checkups, including cervical screening, to help see if you are experiencing like symptoms of cancer or cervical cancer. So it's important to schedule those doctor's visits. You can practice safer sex by using barriers, condoms, and contraception if that applies to the types of sex you're having. You can do regular Kegel exercises at all ages. And you can avoid using douche products or douching in general, scented vaginal creams or deodorants or vaginal cleansing products, again, as the vagina/front hole are self-cleaning parts of the bodies. Finally, if you're experiencing any of the following, make sure to reach out to a medical provider and schedule that STI testing appointment. But if you're experiencing vaginal burning or pain or green or yellow vaginal discharge, a thick vaginal discharge that resembles cottage cheese, could be a yeast infection. If you're experiencing discharge that smells bad, or are experiencing any unexplained vaginal bleeding, painful intercourse or sex, or persistent vaginal itching, or anything else that just kind of is concerning you about what's going on down there, it's important to schedule that doctor's visit and just get everything checked out, make sure that things are, A-okay, squared away. So yeah, that was a lot of tips. If there are any questions, feel free to post them in the chat. We can definitely answer them when we're back next week, continuing to talk about women's health. But hopefully that gave you kind of a round robin toolkit of what to expect about vaginas and front holes and kind of the different age groups of their lives, as well as to help look out for any signs and symptoms in your sexual partners about how that they can, be mindful of what's going on down there with themselves and just know when it's time to go and see a doctor. But before we go, we want to give you a few reminders about COVID-19 and vaccines. If you've already gotten vaccinated, congratulations. You have taken a really important step to preventing yourself and your loved ones and your communities from illness. The Omicron and multiple variants at this point have soared across the United States. So it's totally understandable why you might keep wearing your mask, even though mask mandates are coming to an end in certain places of the country. That said, the vaccine isn't 100% effective and, doesn't prevent people from getting COVID, but does prevent them from experiencing severe illness and death and helps keep them out of the hospital. So thank you for being vaccinated and just stay alert and wear your mask and be mindful of folks around you. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has the COVID-19 vaccine available. Everyone ages 12 and up are eligible to receive a Pfizer COVID-19 vaccine, and everyone ages 16 and up are eligible to receive a COVID-19 vaccine. Please call Whitman-Walker Health at 202-207-2480 to make a vaccine appointment. Again, that's 202-207-2480. And if you're having trouble making an appointment with Whitman-Walker, or maybe you're tuning into this live from somewhere else in the country or somewhere else in the DMV, visit vaccines.gov to schedule your COVID-19 appointment. But for DC residents who are nearby us, you can find information on COVID-19 vaccine walk-up locations and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. You can also track the speed of the COVID-19 vaccination lines by visiting coronavirus.dc.gov/don't-wait. For Maryland residents, you can learn more about the Maryland vaccine distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. If you live in Prince George's County, visit their vaccination registration portal. And if you live in Montgomery County, you can visit their vaccination registration portal or call 240-777-0311 to schedule your appointment. Finally, for Virginia residents, you can learn more about the Virginia vaccine distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 1-877-829-4682. If you haven't been vaccinated yet and you're not looking to get vaccinated, please definitely continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine and discuss COVID precautionary measures with those around you, but especially be mindful of mask and keep your distance from others. But especially when you do not know whether a person has been vaccinated or not. Getting vaccinated is a choice that everyone has to make. And if you don't want the vaccine, then that is your choice. But it is so imperative and so important that you do follow these guidelines to help keep you and your loved ones and community safe. Well, thank you all for your time, for tuning in. Please remember to follow us at Whitman-Walker on Instagram, Facebook, and Twitter. And you can check the website at www.whitman-walker.org for the most up-to-date information on our services. And for more COVID-19 resources in general, you can please call us at 202-797-4439. Again, that's 202-797-4439. That number's pinned in the comments. You can also use it to schedule an HIV or STI testing appointment here in DC. But yeah, please also follow some of our programs and resources at RealTalkDC_ and at NoFilterDC on Instagram. Wishing you all a beautiful and happy Wednesday and that you're enjoying this great weather today. Bye.